Dr. Therian here, and if you're watching this video, we likely just talked about dry eyes during your eye exam. As always, this is just to reinforce what we talked about during your exam and doesn't replace the need for eye exams. So we've got 3 layers to our tear film. We've got a mucus layer that's there to fight off infection, a water layer that's there to make the eye feel moist and good and happy, and we've got an oil layer that's there to keep the water attached to the eye. If you're not making enough of that oil layer, then you have what we call meibomian gland dysfunction. I've already done that video, but this one's going to be more the aqueous deficient if you don't have enough of that water. And so what you'll notice if you don't have that water is fluctuations in vision, itching, burning, redness, stinging. All those kinds of things can affect that eye when we have that ocular surface disruption from dry eye. What I will see on my end is the very front part of the eye will look like it's been sandblasted. There'll be a bunch of little nicks in it. Or maybe I'm noticing that your tear film, the tear lake isn't as tall as it should be on your lower eyelid, or that your tear film is breaking up a little bit too fast. There are a handful of different things that I can look at to kind of see and assess how's that tear film doing and how's your dry eye looking. And so if you're having a little bit of dry eye issues, there are lots of options out there on the market for what we can do. You know, we can do artificial tears. I prefer preservative-free ones, but there's about 500 different versions of artificial tears. I typically talk about 3 of them with patients, not because they're the best or whatever, but because I have to limit it at some point in time to these 3 that work really good for me. And so talk about the different artificial tears. We can do punctal plugs if we need to. We can do amniotic or high-grade tissues on there if we need to. We can do humidifiers. We can talk about taking fans off or turning them off or not having them pointed at us. There's a lot of different options when it comes to dry eye on how to combat this. And the things for you to watch out for. Obviously, if it's getting worse, that's never a good situation. So if it's getting worse, definitely want to get a look at it and see if we can't do something. Obviously, with treatment, it should start to improve and get it to feeling a lot better, but be patient with that. Because the longer you've been dealing with dry eye, the longer it's going to take us to fix it up. And so if you've been dealing with it for a couple of weeks, a couple of months, we can probably get it fixed in a couple of weeks, a couple of months. But if you've been dealing with it for a couple of years or maybe in a decade, it may take us a solid year or 2 to get it fixed up, maybe even longer. And so be patient with it depending on how long you've been dealing with it. Really determine a lot of factors on there. And then if you have situations like, Sjogren's, that's well known. Thyroid dysfunction is well known to cause dry eye issues. And so even if you don't have dry eye issues and you have Sjogren's or thyroid dysfunction, you may consider starting some artificial tears now just to get a little bit ahead of the curve. Again, but not something you have to do. And so as always, this video doesn't replace the need for an eye exam. Those still exist in these situations, but it's just there to kind of help answer questions. And so if you ever have any questions, we're here.